All right, I'm Janelle. I'm a cosmetic nurse practitioner. I am here today to talk to you about all health, wellness, beauty tips. I have been injecting Botox fillers since 2013. I have 2 offices in Los Angeles, and we just opened our med spa wellness clinic in Las Vegas. So please let me know any questions you have. Let me just turn on some lights in here. I can talk through skin treatments. I can talk through treatments I have done. I can talk through what's most popular amongst our patients and answer your beauty questions, because a lot of people get on here and they see different treatments and they just are like, is this right for me? Or what do you think about that? So let me know questions you have. These pictures here are of me. I have done all Botox, all filler, all skin treatments over the past, I've been injecting as an injector almost 13 years, and I have been doing stuff for almost the entire time. And yeah, in our office, we see all skin types, all skin tones. We see a lot of women and men of color. Everything we offer in our office is safe for all skin types and tones, which is really important to me. I'm Filipino and Black. A lot of the women and men we see are people of color, and we focus on getting a natural outcomes where you look like yourself, you look refreshed, nothing overdone ever. We don't want people to be able to know that you have done something. We just want them to think you woke up like that. You're aging gracefully. You're aging backwards. That's always the point and the goal. On our page, you can see patients before and afters, and you can see how they look like themselves. They look fresh. You wouldn't be able to know they've done something. That's the intent with it. Also, we have a lot of patients that we find here on social, and they make videos about their experience. You can read their reviews online, and we just appreciate that because we're always trying to highlight natural looking aesthetics, that yes, you can do these things and still look like yourself and fresh. So that is a goal. Please let me know questions you have. If you don't have questions, I can talk about things that I've done in between these 2 photos. And I can go through talking about the most frequently asked questions that I hear from patients on a day-to-day. So this is me when I was 28. I'm now 38 years old. This was from a few years ago. This was just one photo that I had that looked in the similar thing. This was pretty soon after I had some filler and had settled. I haven't had any recent filler just because I've been pregnant and breastfeeding the past 3 years. But this is after my first child. I have 3, and this one he's 11. And I breastfeed all of them for 2 to 2.5 years. I'd lost a lot of weight. The baby sucked the life out of you, literally. And I felt like I looked really tired underneath my eyes. I felt like I had lost a lot of fat and like fullness in through my cheeks. Naturally, I have fuller cheeks and a fuller face. Felt like the smile lines were getting deeper. This is before I had done anything. And so over time, I have now done all the things. But I think one of the biggest things that made an impact for me, I just really felt like I looked tired. I was very tired. But I did under eye filler. And so that's one of the things you can tell from here to here. And even here, I have since done the all natural filler because I'm breastfeeding. You can't do filler or Botox when you're pregnant breastfeeding. So the natural filler is made completely from your own blood. That's when you draw blood out. You take out your growth factors, your stem cells. We heat it, we cool it, we make a gel out of it. Wherever we inject it, it makes new collagen. So you can do that under the eyes if you feel sunken, hollow. That's what a lot of patients like. Someone said, hey, amazing thing. She said, or he said, I have a lower bleph and I still have a lot of wrinkles under my eyes. What can help with that? So if you still have wrinkling, is it when you smile? If it's when you smile, it could be that you're doing a little bit of Botox. You don't want to Botox too much around here. If you Botox too much, it'll lower the eyelid, but you can do small amounts to help smooth out the line underneath the eye. If you feel like you're sunken or hollow underneath the eyes after your procedure, after your your blepharoplasty, so that's a surgery. If you feel hollow, and I do have patients come to me after surgery and they say like, oh yeah, the fat pad is gone, now I feel sunken or I feel tired, that's where we can use filler or all natural filler. And if you feel like you have wrinkles from being sunken, that's where you're going to go with the filler, like to lift the area. Biggest thing is like get a consult. I tell all the patients, don't rush. It's your face. You don't want to be just making random decisions and letting random people touch your face. Like do your research, do your consults. Don't rush this. Ask your questions. And sorry, trying to get some appropriate light in here. Ask questions. and know everything you can about the procedure. Make sure you're the right candidate for it before it gets done. Okay, let me see if I had some more. So can balancing filler be done with a PRF gel? So yes, so PRF gel, that's what I mentioned earlier. It's a filler made completely from your own blood. We draw your blood, take out your growth factors, we heat it, we cool it, inject it. It's going to make new collagen wherever we place it. We can place this all over the face. Very commonly, people like to do it under the eyes, into the smile lines, into the cheeks. I've been doing this. Like I said, I have my little babies too, and I've been breastfeeding. So it's been like 3 years since I've had anything, but I've been doing the all natural filler the past 2 years. My whole face. This was the last time I had filler. Filler, I think, can give you a little bit more of a contour. However, I like the PRF gel to give natural looking volume over time. And for me being like 10 years older than this photo, I don't feel so haggard. And, you know, the baby's drinking from me and he's big and he's eating cheeseburgers. So he doesn't need to be drinking from me. But it gets better over time. If you want something really contoured, if you want something immediate, that is not going to be your all natural filler. So all natural filler, gradual, it'll improve. And if somebody's trying to like contour their nose, if they have a bump on their nose or they want to lift the tip, I haven't seen it do that in the same way that filler can do. Some people are doing a combination of filler and all natural filler. So biggest thing, we consult, we'll see what is right for you. But I have patients that will do this all over their face. I obviously do it all over my face. I have people that do it temples, eyes, cheeks, chins, jawline. I feel like it did help my chin. Naturally, my chin is a little shorter and it goes like this. And from the side, it sits back. And that is probably one of my favorite areas. I like filler, but I haven't had filler. And so I've done the natural one here in my temples. I think it makes a really nice difference. It's just gets better over time. How much does your office charge for Botox? I'm traveling from Detroit to Vegas. Hey, so in Vegas, they have rules where you can only sell it by the vial. So they have 50 unit vials or 100 unit vials. The 50 unit vial is $650. So that comes out to be like $13 and then dollars a unit. And then the 100 unit vial is $1,300. In LA, it's between $13 with their nurses. I charge $15 for patients that I see. It's your first time. Depending on the areas that you're treating, you might be doing 50 or you might be doing 100. It really depends on what's going on. Yesterday, I had a first timer and she wanted to treat multiple areas of her face. She's like, I want to do my frown, my forehead, my eyes, my jaw hurts, and I want some in my neck. So you don't want to spread it too thin. If you do 50 units through all those spots, you're not going to really see it or it's not going to last long. So we did 100 units, but we were treating multiple areas of her face. But yes, you can come see the team in Las Vegas and in Los Angeles. I see patients in both offices. I was in Vegas twice this week. I did not mean to line it up that way, but I did, and it was great. And we have lovely patients there, an amazing team there. The team there I train with often, and they also come to LA. So everybody, I feel like we all are on the same page. You're going to get the same experience. Everybody focuses on natural looking aesthetics. Everybody, if you look at our team members, they all look natural. They look fresh. Nobody looks overdone. That's always the goal. Like, look at your injector. If they look crazy, you're probably going to end up looking crazy. So be mindful of that. Hey, Aldi said, I did my chin. Oh, let me see who this is. Thank you. I love chin filler. I miss you. I hope you're doing great. Chin filler, I think, makes such a nice enhancement to the face. So we will do chin filler to help elongate the jawline. If the chin sits back or short, the jawline can look short. So it elongates the jawline. Can help give some highlight to the lower face. We can shape depending on what shape somebody wants. Guys sometimes want to be more squared out or more wide. And so I can widen the jawline or make it look more square or more heart shape. So chin filler makes such a big impact on the face. I feel like a lot of women and men of color have short chins. And we have like full cheeks, full lips, full nose. So like most of our highlight is here. And then our chins kind of sit back. Look at the NBA. The guys are like wearing beards and like longer beards because it gives them some of that chin projection. I treat a lot of men too with chin filler, and they like it because it just looks more masculine. They get some of that length. We lose bone here as we get older and fat, and so our chins naturally start to like come in and they get like more dimpled. and our jawline looks a little weaker as we get older. So chin filler is one of my favorite things I've ever done to my face, besides under eye filler and temple filler or all natural filler. I think it made a really nice difference, and I felt like I didn't have to always like hold my mouth open to give me length. And that's what I was doing. I didn't know what I was trying to do, but I always felt like my face looked better, more attractive when I had it slightly parted on my mouth. Okay, let me say. Oh, thank you. Thank you so much. Someone said, is there downtime from it? Let me see what that question was. I'm trying to scroll through here. Is there downtime from it? Bruising, swelling? Yes. Okay. So I don't know exactly from Mama Luna. I don't know what treatment you're talking about. In general, if you're going to get filler or all natural filler, you're going to have some bruising, some swelling. Expect to have it. God willing, you don't. If you really prep beforehand, avoiding blood thinners, avoiding alcohol, taking arnica, eating pineapple, do those things beforehand, it can help minimize the risk for bruising and swelling. But I always tell patients, plan to be bruised and swollen. I just don't want you to like, I'm going to get this and I'm going to go do my photo shoot tomorrow, or I'm going to go see all my best friends for girls' day or my wedding. You want to give yourself 2 to 3 weeks when you're doing filler. After 2 to 3 weeks, you're in a pretty good position. You kind of know what the results will be. You might feel little bumps. If you make a weird face, like, you might see a little bump, but those relax at 6 to 8 weeks, but 2 to 3 weeks after filler, you're in a pretty good spot. So that helps you with planning your appointments accordingly and before your events. And we talk a lot about like, what do you have upcoming? Are you flying? Flying can make you swell a little bit longer. Are you going to be in a sauna? We ask you all these questions because we want to make sure that whatever treatments we're doing, it's going to fit in your lifestyle and the timeline of the event that you're trying to, be ready for. All natural filler. So that's with regular filler. All natural filler, consistently, I see patients, they're swollen. It looks a little ridiculous. It looks overfilled for 3 to 5 days. After that, it goes down. I've never had anybody that has like bumps that last. Oh my gosh, these bumps are there. So I like the all natural filler. We've not had any issues with that in any of the patients. I've never had issues like any of them, any of our patients, any of our providers. It chills out really nice. Usually within a week, and people are like, yeah, cool, I like it. You might be bruised a little longer, but like the swelling goes down pretty fast with that one. For Botox, you could be bruised. The needle is a lot smaller for Botox. And what that happens when we do that, like, frown, forehead, around the eyes, you'll have like these little bumps on your face. It looks like little bee stings for like 15 minutes, 20 minutes. It goes down quick. If you ice it, just leave it alone. So you can get back to life very quick with Botox. You might be bruised just because a bruise can happen. We've got blood vessels all over our whole face and body. So you might be bruised. So, if you're like, I'm taking my wedding photos tomorrow, don't come and do Botox the day before. If you have events and you're trying to get ready, like do your consult and try to do this well in advance of your events, or just do your consult and be like, hey, I'm planning for this event in 2 months, in 3 months, in 3 weeks, whatever. Let us know so we can say, yes, is this timing right? Can we do this now? Or should we wait till later? Or all the things. You don't want to rush these things. When people are like, I have this, my wedding is in 3 weeks. I'm like, dude, we don't really have time to do this. So we want to be mindful. I just don't want to risk you being bruised, or there is a little bump somewhere. Like you want to be mindful of all of these things and plan well in advance. Okay, let me see how much for a session of microneedling with PRP. Oh gosh, I don't want to tell you the wrong price. I think okay, you have to look on the website. So right now our website is under JanielleBeauty.com. GINILLE beauty, BEAUTY.com. I have our pricing on there. And like pricing for everything. We want to be super transparent. We're never trying to like hide something from people. We're not trying to okie dokie you. Before you do anything, before you come in, we send you pricing. When you're there, before we do the treatment, we go over pricing. But I just don't want to misquote you on that. We are going through a name change right now. So like slowly we're going through switching out of Janelle Beauty from our Los Angeles offices into Jossie Skin and Wellness. So that is how we introduced our Las Vegas clinics, and our LA clinics are like going to be changed over this month. So that is really nice. And we'll have all the pricing there as well. We do have a skin membership program that is very popular amongst our patients. So all of the treatments in our office, the skin treatments. So we have Hydrafacial, skin pin microneedling, we have the bio-repill chemical peel, and Aerolase laser. So everything we do in the office, safe for all skin types and tones. That's always a big thing for us, like making sure any and everyone can do it. You can come in on a monthly basis and choose which treatment you want to do. Almost all of our treatments can be stacked. You can combine 2 or 3 treatments same day if you would like. We have to talk about your goals, what's going on with your skin, what you're getting ready for, any concerns, your lifestyle, and we can help give you recommendations on, hey, we think you should be doing this treatment because you're working on acne scarring, so we're going to go a little bit more aggressive and we're going to do the microneedling and the chemical peel combined. You're going to have some downtime. Oh, you don't have any downtime? Okay, so this month we're going to skip your microneedling. Instead, we're going to be working on doing your chemical peel. This is a little to no downtime peel at all. So we have the ability to choose which treatment will be right for you, and you can switch on a monthly basis. For the skin membership program, it's $3.99. That covers your treatment for the month. And then if you want to add on or stack more treatments that month, it's $250 to add on or stack. And so a lot of patients are coming in. The most common ones they're going to be oh gosh, I love all of them. But the laser, the chemical peel has been a big hit, microneedling, like all day, like honestly, all of them. And people will switch between. So that is really nice based on what their goals and concerns are. If you're having a lot of acne, we're going laser, we're going with the chemical peel, we're going to avoid microneedling. If you're like, hey, I'm just doing overall, I want a pretty glow, we might go chemical peel and Hydrafacial. So we just got to talk about you, assess your skin, see what's going on, see what you have going on, life, and what you're getting ready for. I don't do surgery in our office. We can make recommendations. Everything that we do in our office is non-surgical. We do work with our medical director is Dr. Michael Arnstein, and he is plastic surgery in Los Angeles. He went to Stanford with me, but long before me. And he's wonderful. So we can make recommendations based on you and your goals and concerns. But everything in our offices are non-surgical. So you can look at patient before and afters on my page, and we have a lot of them. I feel like we're able to get really good results that sometimes look, not even sometimes, a lot of times can look surgical. I know my limitations with filler and Botox, and I'll totally tell you what I cannot achieve. But the patients are happy because they're like, I don't have to go through surgery. I still look fresh. I look like myself. I don't have the downtime. It's a fraction of the cost. But the biggest thing is like, yeah, they like it. That's what we're trying to do. And if it's a surgical thing that we recommend, we will give you recommendations and tell you, hey, there are limitations with Botox and filler. Like, there's some things people are like, I want the cat eye. I'm like, I can't do that. There's nothing I can do to pull your eyelids like that, your eyebrows. I know nothing. I'm going to pull you way up here. However, we can use Botox and filler to create an illusion of a lift and get some pretty good results with that. You can see. Okay, do I travel? I just travel between our offices. So we have 3 locations, 2 in Los Angeles, 1 is in Mar Vista, 1 is in Torrance. I'm mostly in LA because that's where I'm based, but we also have a location in Las Vegas. So I was just there twice this week, seeing patients. And I have a whole team of providers that I train and work with, and these girls are excellent, and they have their own whole book of patients. Like, our patients are awesome, and you can totally come and see the team. We all are focused on natural looking aesthetics, skin health, hair health. We haven't even talked about hair. We have a weight loss and body program. So come in with the team, do a consult. I just know about just about every single patient in the office because I'm reading through all the notes. I'm talking with the team about, hey, how's that going? What's going on? Hey, have you considered this? Like, any of the things we go through, we are in constant communication about our patients. So yeah, someone said, is 28 too young to get filler? I don't want to say it's too young. It really just depends on your face and what's going on. So I was 28 in this photo, and this is where I just felt like I had lost a lot of weight. I hear my kids outside screaming. They're playing. But I had lost a lot of weight after breastfeeding my oldest, and he's now 11. And I felt really sunken underneath my eyes. My cheeks didn't look as lifted. I was seeing more of that little indentation here. Smile lines were just looking heavier because I didn't have that much fat in my face. And temples were sunken. This is after I had done filler. This was probably 3 years ago, like around the last time I had filler in my face. I've now been feeding my third kid, so I've been doing the all natural filler, and I like the all natural filler. I'm not like trying to hurry up and kick him off. I mean, I am trying to kick him off, but like in this photo, I felt really self-conscious about how I looked because I had lost a lot of weight. Where I am now, 10 years later, like I don't feel so dead and beat. I mean, I'm dead and tired, but like I don't feel like I look so haggard because I've been doing the natural filler. So I don't think 28 is too young. We see a lot of patients in their late 20s into their mid 30s that are coming in for their first time. Depending on what's going on, if you have lost a lot of weight, people might come in sooner. Very commonly in our late 20s, early 30s, people will start to see early signs of aging, and they'll have like a little bit of under eye hollowness, like this line that kind of comes from under their eye into the cheek. So they'll see like little shadows of this. They're like, what is this little indent, or what's this line? They'll notice that this smile line looks deeper and the corners of the mouth has some little shadowing, and their cheeks just might not look as lifted. So 28, you might see like the early signs of that. As we get older, if you look at patients on my page in their 30s, 40s, 50s, you'll see the same sort of thing, but it's like this line gets deeper, this, their face just kind of doesn't look as lifted. This fat pad here will keep falling, and so it kind of creates more of a irregular looking jawline. It creates a jowl. So we do things to help camouflage that. We might do some into the chin, into this area along the jawline to camouflage it. But yeah, I don't want to say it's too young or too old. Like this is really based on what your goals are. Other people will come in for, nose filler. They feel like they have a bump on their nose. They want to camouflage a bump, lift the tip of their nose. They want to minimize some asymmetries or create it looking like a little thinner from the front. We can do filler in the nose. And I've treated people 18, 20, like, they're like, my mom's not going to let me get surgery, but my mom is here and says I can do this instead for my nose. Lip filler, if somebody feels like their lips are like not as full as they want, or if they want to hydrate, they want to plump, they want to like soften some of the lip lines and improve the texture, that's where we'll do filler. Okay, let me see. Do I reshape the nose? Yes. So I mentioned that one. Camouflage a bump, lift the tip. You can make it appear a little bit thinner. It's not going to be super pinched in the way, surgery can get it. You can also do Botox along the nostrils to prevent the flaring. I have a lot of good nose. I think I have a highlight on my page of nose filler before and afters, and I feel like those look surgical. Like the results are surgical and patients are happy. And so many patients are like, I didn't have to do surgery because this did what it needed to do. I tell patients it lasts a year and a half to 2 years. Most patients will get longer out of it. And so that's really nice. I had somebody come a couple weeks ago, and she came for her nose, and I was like, hey, what are you doing? She's like, you did my nose 2 years ago. And I was like, okay, what do you want to do? She's like, my nose still looks great, but you said to come back at 2 years. I was like, oh, it still looks great. Like, we don't need to do more. So we checked in. She was good. I was like, if you see the bump coming back, we can talk about doing more. But you never want to overdo with these things, guys. So go slow. Do your consult. Don't rush it. Ask questions. Have an active voice in your treatment planning with your provider. I tell, like, if you come and see, somebody said on here, our team is really nice and personable. Thank you. Like, we all see our patients as like more than just like a Botox and filler thing. Like, we are really knowing about your lifestyle, what's going on, what are your goals, what are you prepping for, because it helps in guiding the treatment. Why are you doing this? And there's people that like, a lot of my patients know I say no for a lot of things. Like, if I just don't think, I'm not the beholder of beauty, but if I'm like, dude, I don't think that this is going to look right, or they're like, am I being crazy? I'm like, yeah, kind of. You are. Like, if you just put more, you can do this. I'm like, no, I can't. Like, just do it. I'm like, no. And I'll just tell them, I want to be real. We're never here to like try to swindle anybody. We want you to look fresh. Like, you going out, I don't want you to look crazy. And then you're like, yeah, Janelle did that. I'm like, oh, no, I didn't. So we want it to look like you. We want it to look fresh. We want to make sure that we are aligned. The patients that come into our office, we love. They're so, like, they're on the same page as us. Because some people might think like, oh, this is not enough. Like, this is too boring. Like that's not, I want to be more snatched. And that's totally fine. Like you can find an injector that's going to be able to do what you want to do. But the people that come into our office, they're already like, hey, I like the way your results are. Like the people look like themselves. They look fresh. I like myself, but I'm also just seeing some of these like signs and I want to do something about it. They understand we're not trying to rush through treatments. I'm not trying to just shove a bunch of filler in your face and no, like we got to do things gradually. We want to make sure your skin looks good. We don't want to just be doing Botox and filler and then your skin health is not great. Like if you have a bunch of dark spots, if you have a bunch of acne, I'm like, okay, I can get rid of all your lines and plump up your cheeks and lips. But like, if your skin doesn't look right, this is not going to match. Can I tell Jason, what part of Los Angeles are we in? So we're in Mar Vista, so off National Boulevard and Barrington. And then we're in Torrance off of Torrance and Hawthorne. And yeah, the girls are running in clinic today. I don't usually work Saturdays, but I am in clinic multiple days a week between those two offices. And then Vegas, I'm a couple times a month. Okay. Someone said, Alice said, she will tell you, nah, yeah, they know. My patients come in, they're like, I know you're about to say no, but, and I'm like, why don't even ask me, but I'll hear you out and we'll talk. And I will tell you realistically if I think I could achieve what you're trying to do, or if I'm like, girl, we're not going to do it. Like, it's not like, go get a surgical consult. And I don't even know if surgery can do it, or like, stop, you're beautiful. You don't need this. We don't need any of it. I always tell people, like, get out of here. Like, you need to know you're beautiful, period, without it. And I love Botox and filler, and this is what I do for work. But, like, you're fine. And so we have to go through those things. Courtney, hi. She said, I did her lip filler. Thank you. She said, looks very natural. You recommended to go slow. That's the goal. I'm like, don't rush it. I know everybody, I think, can recognize when work looks bad. And so we're walking on the streets, we're in LA, we're in Vegas, you're like, oh my gosh, everybody that gets filler looks so bad. Their lips look so overdone. Oh my gosh, their cheeks look like this. It's because we can recognize what looks bad. If you see these patients, I mean, if people coming through the call, through this whole time, you're saying, you did my chin, they liked it, looks so great, the lips. Like, you wouldn't be able to know you did something on these people because it's going to look like them, it's going to look fresh. Don't rush it. Thank you, Courtney. We don't want to overfill. So we say, do it, let it chill. We can do more later. If it gets to the point where like, hey, if I keep adding to your lip, it's not going to make your lip fuller. It's just going to go puffy above. I don't think you should do it. We're going to have that conversation and not do it because you're not going to be happy. Like I tell people, I'm like, some people have really thin lips. They're like, I want to have it like this celebrity. And she went from super thin to really full. I'm like, but those photos are like edited. And like, if it's puffy up here, that's not doing what you want. And so people will then say, my filler migrated. I'm like, I don't really think it migrated. Like this filler is not slipping and sliding around your face. It's really overfilled. Like you kept trying to add more to a certain spot. There's not any space left. So that is like the injector trying to keep going. It's just going to go where there's space. So like around the lip. I know people get on here and they talk about filler migration. I'm like, it's not like that. I do filler on people every day. And I have been doing this since 2013. And my patients are not coming back being like, this is all me. My filler, you did it here. Now it's here. I'm here. Like, it's not moving around. But I say go slow because if you overfill, if we do too much in the area and there's not space, it's just going to look puffy. So don't rush it. Like go slow to your goal. It will get there and you will be fresh and be beautiful. You'd rather to go slow than rush and be overdone. That's not going to look great. Let me see if I can find any others. I'm just trying. Someone said, oh, Jay, you're in Vegas. What's the name of the clinic here? So Jossie Skin and Wellness. We are on the Summerlin side, 8861 West Sahara Avenue. And then, yeah, the team is there today. I was there this past couple of days and we saw patients and we went live yesterday. We were showing, one of our patients was showing, she came and did the laser, the chemical peel, the all natural filler. And she was like, you can totally show about it. I'm constantly trying to show real people, real results. So you're not just hearing me talk about it, but you can see it from others. And like, even in this live, like I said, there's been patients on here saying, you've done this and I really liked it. And I like highly appreciate everybody that shares just because it helps natural looking results be seen. Like if it weren't for my patients sharing, you would not know they've done anything because they just look fresh. Like they're just going to show up and you're like, dang, why does that girl look so, her genetics are good. It's like genetics, but some Botox and filler. So shout out to my patients for sharing. So many of them over time have made their own videos or will film in the office. And you don't have to do that. But like, I really just appreciate because other people can see themselves in you and like, oh, I have a similar concern, or I have struggled with that, or that is something I didn't know you could do. I hear this every day. I didn't know it until I saw a video on your page. And I'm like, yeah, you wouldn't know. Like all of us in this office are filled up with filler. Because if you look at our team, look through the photos, like these girls look natural. They look fresh. Like we're not going to overdo it. That's the goal. And I think everybody just thinks it's going to look bad if they get filler. I'm like, no, it's not it. It's not it. Do I like Botox or Dysport better? I use in our office Botox, Dysport, Xeomin. On myself, I will grab Dysport. I feel like it's a little stronger, lasts a little longer for me. They're all great. So some people, I tell people, I'm like, try the different ones, see if you have a preference, see if you can tell a difference or something you prefer. We price them the same because I don't want people to be like, I want the one that's cheaper. Like, I don't want people trying to pick and choose products based off of price. So even for my filler, I price it all the same. Whereas, some clinics are like, this one is $100 cheaper or $50 more. I don't want that because then patients are like, just give me the one that's cheaper. No, like we want to choose the product that's right for you and your face and your goals and your concerns and what's going on based off our consults. So that is how we price our syringes. That's how we price our products. And we make it easy for the patients. Because then the patients are confused, like, what about this one? And you can ask, like, there's always a reason behind which product we're choosing and why. But before, when I've worked in other offices and we priced everything different, they'd be like, my best friend did this one and I want to do that one and it's $5 cheaper. I want to do it. And I'm like, yeah, but that's not going to get you the outcome. You have a different face than your best friend. So yeah, we try to make it, straightforward and where everyone can understand it. I'm going to come on here every time, 5 feet, 10 inches. I'm come on here every time and ask you to come to New York until you get here. Okay. New York is a big one. We see a lot of patients. So Vegas, we see, and that's why we went there. That's our third place. Texas, Houston, and Dallas. I get a lot of Texas. I get a lot of New York. And I think we were just posting some videos of a patient that like, she flies from New York a few times a year and does her thing with her man. They come and they do it. Florida is another one. New York, I was like in the partial halfway done of getting my license. And then sometimes when I have to transfer my license to these other states, they're like, you need to take this extra class. I'm like, dude, I've been doing this since 2013. I went to Stanford. I went to Duke. Like, I don't want to pay anymore for like a random class. Texas is trying to hold me up on my nurse practitioner license. Like, take Texas history. I'm like, but God willing, one day soon, if I can sit down and do these extra random classes. Okay, let me see if I missed any. Okay, 23 messages. Can I reduce gravity in the lower face? Maybe from too much injectables in the laugh lines. Okay, so if you feel like you have too much filler through the smile lines, my first thing is going to be like, let's assess this, but very likely I'm like, let's break this down. Let's dissolve it. That is, so the person mentioning this, if you feel heavy here and you've overfilled it over time, dissolve. And that is another reason why I tell people, I'm like, don't spot treat. Assess your face, like make sure you're going to somebody that's assessing your full face and not just treating here. A lot of people come in. Anytime I make a video about smile lines, people are like, oh, smile lines. Everybody sees this line and they notice it getting deeper. Like, what is this line? Fill this line. And I have to tell people, so this line is, you're starting to see this get heavier because we lose volume through our mid face, through our temples. We lose bone and fat. So I tell people it's not just the line that we're treating, but we also have to consider, these other fat pads that start to separate. So if you look at yourself, you might start seeing this little line right here, kind of cuts from the under eye into the cheek. That'll get deeper as we get older. And then it kind of pushes down. So this is a fat pad. This is a fat pad. These fat pads separate. They start to sink. We lose fat here in our temples. We lose bone in these areas as we get older. So I'm always telling patients, we got to assess your full face. I can't just treat this line, or I can do it all day. I can get rid of the line, but then this is going to be puffy. blown out, and then this is going to be saggy and it's going to look weird. And I think that is how a lot of injectors inject. They just treat the line. It really requires a skill and like an aesthetic eye and understanding of what's happening with facial aging, and then also being able to explain to your patient what is going on as we age when we're doing these treatments. So that way it looks fresh. It doesn't look overdone. We're not line chasing. That's why we're thinking about the full face. I say the word on here, facial balancing, for people because people will mention that word, but I'm like, that is really, we're considering your full face. We're looking at you and your aging process. We're looking at, oh, you told me you just dropped 20 pounds, 50 pounds, 100 pounds. I have been hearing all of that the last 3 years with like weight loss medications. So like, where are you losing? You lose fat in your face too. Like all of those things make an impact on this line. So first, if this is heavy, we dissolve. Second, we have to look at when we're looking at the lower face, if the lower face is heavy. So this fat pad keeps sinking, come down here. A lot of people will start to have this jowl as we get older. So they'll be like, why is my jawline looks like kind of hanging? Some fat pads descending, sinking as we get older. So a few things that we can do to help create a highlight, create a lift. So we might be doing filler back here and through the temples, because you don't want to just do your cheeks. If you just do your cheeks, which a lot of people do, I see it in LA, they got these big cheeks, and then this is sunken above, and this is sunken below. So it looks like this crazy thing here, and then they got big lips and no smile line. I'm like, dang, they look wild. And like, why the heck is their injector doing that? I'm like, oh, sheesh, their injector looks like that. I'm not trying to be mean, but I'm like, guys, that's not what a face looks like. That's not looking good. So different things you can do to help create a highlight. It's not surgical where it's actually pulling you back, but we're creating this illusion of things looking lifted by placing in certain areas, into the chin, along the jawline. We call it pre-jowl sulcus, like in front of this jowl fat pad. Sometimes we might dissolve this jowl fat pad with Kybella. So all the things, it might be just like, hey, we need to assess your face and see where you're at, if we need a breakdown filler. And if you've had a lot of filler over time, it can take multiple sessions, multiple vials to dissolve. I'm going to always be honest with you. And so my biggest thing is like, do it right the first time. And like, if you choose a provider based on who you trust, look at their before and afters, read their reviews, ask them a ton of questions, ask them all the things. I'm like, you can ask me every question about your face and why I'm deciding to do X, Y, and Z, and I will have a list of answers. Nothing I do or the team, nothing we do is random on your face. Like, there is a reason why I'm choosing this product and this amount on you, and it could be your twin sister and be completely different. So all of this is made based off of our consultation when we're kind of like, what's going on in your life? Oh, you're planning to lose more weight? Okay, let me think. So we might be needing to do some collagen stimulation because she's going to lose more, but she's still feeling more self-conscious right now because she's already seeing, the fat loss in her face. So I'm going to give her a little bit of immediate lift. So I might be doing some radiesse. Like, there is thought that goes behind each of these things. Okay, I talk too much, guys. Let me see if I can go through these questions. Shelly, I went to Stanford and Duke. Yes, I did. I went to Stanford. I graduated in 2009. I did human biology, and it's called comparative studies in race and ethnicity. So basically ethnic studies. And then I went to Duke for nursing, and I finished my bachelor's at Duke in nursing in 2011. And then my master's, I'm a family nurse practitioner, in 2013. So it was a lot of student loans, but I paid them off, and I'm very grateful. So yes, and then let me see, because Texas history is going to be very helpful. I know. I'm like, you guys are really holding up my nurse practitioner license for that. I have tried, and I will try again, because that was the place that I was going to go before Vegas, and it was just those like random little things. But Houston, like anytime I look at any people, everybody's from like Texas, they come through. Okay. I have an issue with my chin area, like pimples under my skin. Arizelda, okay, come to our office. Also, I want you to come see Niani. She's our dermatology nurse practitioner. I say, come, Black dermatology nurse practitioner. Excellent. It's very rare to find a woman of color doing dermatology. But she has really helped to lead like the skin clinic portion of our office. And we treat a lot of acne, a lot of skin conditions in our office. dark spots, rosacea, acne scars, hair removal. We do all of that all day long. We really have become like a forward-facing skin first clinic and then injectable second. And so for under, hormonal acne is typically when it's along the chin. If they're like around your cycle, they're big, cystic, red, painful, hard bumps, those are usually hormonal. And so we do a few things for treating hormonal acne based on your lifestyle and what you're open to. Aerolase laser is great at killing bacteria in the skin, reducing redness, inflammation. We will see patients for acne every 1 to 2 weeks for the laser. If it's really, really bad, I only have a couple patients that we have to see on a weekly, but most patients, they're going to be coming like twice a month. After about 2 to 3 months, their acne, they're like, oh, I get one if I get one by my cycle, or like it resolves really fast. So 2 to 3 months of that. In the meantime, as we're doing your laser, we're also helping you with skincare at home. So sometimes we help with like a benzoyl peroxide, 10% wash. We'll help with prescription medications that we prescribe and can dispense in the office, clindamycin, tretinoin. Like it just depends on what's going on, spironolactone. So we have to talk about, hey, do you want to take a pill every day or no? Do you want to just do something topical or no? What is going on? But we do a lot of acne in our office. Sometimes we'll also be doing it with the chemical peel. 2 to 3 months, the patients are like happy and they're feeling themselves. And it's not just their chin and the acne, but like the rest of their skin is starting to really look glowy. And then they can start backing off to might be just like once a month for their skin treatments. And we might be working at that point on pigmentation, textured scars, and we might switch up the treatment plan. It might be combining it with microneedling. So come in. We do a lot of skin on the day-to-day. We also have just like skin enthusiasts. There's a big creator on here. Her name is Claire Almond, and she is also one of our providers in our office. And she loves skin. And like, if you come to the clinic, you just come look at everybody's skin. And that alone, like the people walk in, they're like, I'm just going to listen to you guys because everybody's skin looks great. I'm like, yeah, that's the point. Like, it would be bad if my skin looked like trash. Like, I don't wear makeup. I don't wear makeup. Period. Like, and it's because I've done all the skin treatments and you can just feel confident in your skin. Patients are honestly happier with that than like even the Botox and filler. Even though I love Botox and filler, I am an injector at heart. I am like injector first, but the skin thing is so impactful. Shelly, what should I do for the lines under my eyes and on the sides of my eyes every time you smile? So those are created from this muscle around the eye. The eye is a circle like this, and the function of the muscle is to close in. It's like that. So it goes in like that. You can use, if you notice these when you smile, you can do Botox, Dysport, Xeomin, any of the Botoxes to help soften the muscle from closing in so tight. Underneath the eye, if you get them when they smile, you can do a little bit, not a lot. So I tell patients, I'm like, I can't get every single line gone underneath the eye if you have a lot. If I do too much underneath here, it's going to pull down your eyelid because it's going to weaken that muscle. You don't want that. So you can do a couple units there. Here, you can go more aggressive. It just depends. Some people are like, I want no line. Other people are like, I like to have some lines. They're happy lines. So they just soften them. So that's with Botox. At home, you can do your retinoid with moisturizer. So we have a really good retinoid and Resurface RX. We have a Drossy Skin Recovery Boost to help like tone down the irritation from retinol. Your sunscreen for sure. And then if there are like lines at rest that not when you're smiling, that's when we can look at skin treatments like microneedling or the chemical peel. So we can assess it in person, but those are kind of how we will approach it. Like you doing your part at home, in office, what we can do skin wise. And then if you're really just like, get these lines away right now, like we can get them away pretty good within 2 weeks with your Botox, unless you just have like deep ones that are at rest, even if you're not moving and they're just etched on the skin. Okay. Do you eat eggs a lot? I think that was for the person with the acne. Somebody was saying, do you eat eggs a lot? Yes. So we'll look at diet too. Like, sometimes we're just like, what triggers it for you? And they're like, every time I eat milk or dairy or cheese or chocolate. So we're like, okay, let's try to cut that back. So we always want to talking to you about lifestyle. You guys see I'm yapping a lot. It's like this in clinic too. I'm not trying to be extra with the talking, but we want to make sure you can make informed decisions, educated decisions, understand what we're doing and why we're doing it. And again, I love Botox and filler, but like I can get rid of the lines really quick, but like how can we avoid this? What can you do on your part at home and not just relying on the devices or the Botox or the fillers? So we really got to know about you, your lifestyle. And if you see the patients that come to our office, like we know that, like we walk like, hey girl, like hugging them. How was the trip? How was this? We know what's going on. We love you. We love being a part of like your story and your journey and like you sharing all the things. Thank you, Nikki. She said, loves my content on YouTube. I know I'm trying to post it there. I'm going to be posting my lives there too. Shelly said she was on Mounjaro. Okay. So anybody on weight loss medications, which I have seen a lot the last few years, and we offer it in our office as well. We do Zepbound, which is tirzepatide. We do the name brand of it. So people will tell me, I lost 20 pounds in 3 months. I lost 40, 50, 60. I lost 100 pounds. I've seen a lot of 100s. And one girl on my page, we have videos. I probably have to like repost it so you can see it soon. But she came in, she lost 100 pounds, and she was just like, I really am happy with my body, but my face, I just look so much older than I felt like I did before I lost this weight over the last year. So we lose fat in our faces as we get older. Fat pads start to sink, fat pads start to separate, and things just don't look as lifted. So that is a big thing that we have been seeing over these past few years. People are coming in because they're like, my face looks different. I lost 20, 30, 50, 60, 100 pounds. And now what's going on with my face? So what they will typically notice with weight changes, and this is not just with weight loss, this is with natural aging, what's happening. And I was mentioning this maybe 10, 15 minutes ago, but like with natural aging, but weight loss kind of makes us see it sooner. So remember, different fat pads on our face, they start to separate. They start to sink as we get older. So they'll notice this deep line here from their under eyes. They'll notice this. The temples will start to look hollow. This one comes down. The corners of the mouth look like a sad line there. And then this creates a jowl from these fat pads dropping. So when we're thinking about this, we're thinking about the full face, we might be injecting filler into the temples. No one thinks about this part. When I'm like, dude, when you do the temples, it really helps extend the highlight of your cheek. It makes your cheek look lifted all the way up. You don't want to do just cheek filler. Here's your cheeks, and then it's sunken. It's going to look like you've done cheek filler. It's going to look bad because you're just treating one spot and not the other spots. And so now this is big and this is sunken, and people can know you got cheek filler. And you were trying and like it didn't look right. So consider the areas above and below. Not everybody has to do every single spot that I'm telling you, but like these are we're looking at the whole face is what I really want you to just understand. You know, some people have really full temples and I'm like, oh, you don't need it. Or we're just doing so minimal, you know, on your cheeks. It's not going to look jutted out and sunken. But the biggest thing is think about the full face. And I'm trying to make sure you understand all the spots. So we might do a little into temples, the cheek. We don't usually do a ton into this part because this fat pad is usually what people will feel like looks heavier. We'll kind of go into that line and back. The eyes, if they're sunken, so we'll do a little into here. And I tell people it's not just here. You got to look at this part as well. So this part of the orbital rim or orbital bone. So it's like a circle. Think about the skull. It looks like a circle here. So a lot of injectors just inject here. And so this is lifted and then this is sunken. And I'm like, that looks bad. People don't know why it looks bad. I know why it looks bad because I do this for faces, but I'm like, it's just unfinished. Like this is lifted and then this is sunken. So now you have highlight here and then a big shadow here. It looks off. Like we can't catch what's going on, but it's something weird. Okay, so then we might do a little smile line. Right here, we lose bone by the side of the nose. And so this will be the deepest part of the smile line. So sometimes a lot of times I don't even chase the smile line. If I just inject this part right here where we lose bone, it brings it forward. This whole smile line will look softer, but it also looks natural to keep a little bit of the line. I tell people if we're going to do your smile line, we can soften. The goal is not to take it all the way down. If we get it all the way away, it's going to look puffy. I know somebody earlier was mentioning that she felt like her lower face was heavy because she's been going somewhere and she's been getting too much filler in her smile lines. And I told her, probably, I got to see your face, but probably going to dissolve it. So you don't want to overfill any of these areas or it's going to look inauthentic. I tell people all the time, like, you're going to have a smile line. We smile, we move our faces. If you don't have a smile line, it's going to look weird. It's not going to look like on social where we can blur it out and you have no line and you're just like not moving your face. I'm like, it's not that. So weight loss, here, all the spots, here, maybe here, here, all the spots. Biggest thing is like, we got to assess your full face and what is going on. Okay, let me keep seeing. Please check my answer. I'm in LA. Consider, Shelly, which one did you see? You said you're on Manjaro. Let me see what should I do for the lines under my eyes? Okay, I got that one. I think I saw it. If I missed your question, Shelly, will you write another one? I keep talking too long, but I think I got yours. What did I do for my under eyes? I did filler in between these two photos. And then since this photo, this was like almost 3 years ago, I have done the all natural filler. So that is Easy Gel PRF made. It's like we draw our blood, take out the stem cells, the growth factors, we heat it, we make a gel made just from my blood. Nothing else is mixed inside of it. And we've injected to like maintain my results. It makes new collagen wherever we inject it. So I have patients, I've done it all over my face. It's the only thing I can do since I've been breastfeeding this big baby. He's 2. And you can't do filler while you're breastfeeding. I've done my under eyes. So it helps new collagen. We lose collagen as we get older. We lose elastin in our skin. Those are the building blocks of our skin. It helps things look lifted, looks youthful, bouncy. And so new collagen wherever you inject that natural filler over time. When I first did the natural filler, just to give you guys a heads up, I was like, I don't see a difference. I was like, that was a waste. I don't see a change. Because I'm used to using filler. I'm used to like, okay, I see the depth, I see the hollow, put filler, it's going to give me the instant lift. With the all natural filler, it's not super instant. It gets better over time. I tell patients, I'm like, the younger and healthier you are, the better the outcomes. Our patients in their 20s to 40s, even some in the 50s, they really like the results. And some people are like, I'm just going to do this and I don't even want to do filler. Like, I like it. But it's not quick. I tell them it can take up to 6 months to get better. So now the patients are more coming in and they're like, hey, I'm seeing these signs of aging, early signs of aging. I'm not completely depleted, but I want to get on top of it. I want to do the all natural filler before I have to feel like something is super bothering me and I need filler immediately. So think of it as like a fertilizer. Think of it as an investment in your future self and doing it the natural way. I tell patients the healthier you are, the better. So if you can have a healthy diet, if you can not be smoking, drinking, doing all the things, because those things, like, it's all based on the quality of your blood, the nutrients there, and based on your body's environment to make new collagen. So in general, the patients coming to see us for the most part are just like really healthy and they already are, wellness forward when they're coming to get these treatments. It says I have 42 messages. I need to keep going through here. Tracy said, do I do chin lipo? I do not. We can refer you. Like I said, our medical director is Dr. Michael Arnstein. He is plastic surgery in Los Angeles, and he can do that for you. And that will help reduce fat cells underneath here. And it's quick. One and done, I'm pretty sure. So other non-surgical way to get rid of fat cells permanently is using Kybella. I like Kybella. I just tell people, this takes multiple vials, multiple sessions. This is not a quick fix. Kybella is an injectable that will permanently dissolve fat. It looks pretty swollen right after you do it for about 7 to 10 days, noticeably swollen, and then it goes down, but it can take 2 to 4 sessions in treating the same area. So that's why I tell people, I'm like, if you're open to surgery, do that surgical consult, maybe just go get it sucked out as opposed to us having to do these injections 4 times. But I have some people that say, I don't want surgery, or I'm not a candidate for surgery. Or I had one girl, she's like, I did surgery so many times, I don't want surgery. Like, just do the dang dissolver, the fat injection dissolver. Okay. And then what do I recommend for slight? Okay. Jim said, do I have experience working with Ehlers-Danlos? I don't, that I know of, but if you can, let me look it up and talk to me about what your symptoms are, what's going on, and then we can see if there's something that we can do. What do I recommend for slight chin fat? So that is where we talked about either a few things you can do. If it's just a little bit and you don't want to do full surgery, you can do Kybella to permanently dissolve fat. You have to really see if it is fat or is it like the muscle. So if it's the neck muscle, you see these muscles here? When I flex, if it's these muscles that are flexing that you notice, that's a Botox thing. And if you Botox this, it'll kind of tighten along your jawline and make the neck look smoother and tighter. So I have to look at you. Some people are doing multiple things depending on what's going on, but I kind of have to like see you, feel you, watch you express. I can do these virtually or in person. Yes, Dr. Michael Arnstein, and he is, like I said, he went to Stanford with me well long before me, but he's wonderful and super bright, and he's in plastics. Dr. Stoker is another Stanford alum that I like the Stanford ones. I mean, there's what does this say? Drag your puzzle piece into place. I think it was saying I was inactive on my live. I'm active. I'm here talking. Dr. Stoker is in Marina Del Rey. I just like people that I know are going to be excellent and diligent and are going to take their time and do the right thing and that I can trust. And so those are a couple. And I can look up some others, but those are good ones that I have referred people to and people like. Okay. Let me see. What do I recommend for smile lines and crow's feet? Smile lines, this or this. Okay, this might be your smile lines you're talking about. This Botox to soften the muscle from scrunching in. If it's this filler or all natural filler or collagen stimulator, but not just treating here, we're also considering treating through what is causing this line to get deeper. And so usually it's our fat pads separating and sinking. So we might be doing a little here into the mid face or into temples. Got to assess your face. Some people, I'm not going to say I always have to do the full face, because people come in, they're like, oh, you got to do my full face. You got to do my, and sometimes I'm like, actually, you don't. You know what? You have a really pretty cheek highlight and your temples are full and you actually don't need that. But I can see where you're saying the smile line is bothering you and we can just soften there. But the biggest thing is we assess the face. We assess your full face and what's going on and your lifestyle and all the things before I decide it's just going to be smile lines or if we have to treat multiple areas. Okay, let me see. Benefits in getting Botox. Lots of benefits. I will talk through some. So Botox, people will like to do it for, if they feel like I frown, I have these mad lines. I'm always looking mad at people, or I have these horizontal lines, I look worried, or these are around my eyes. Some people just don't like the aesthetic look of the line, especially the mad ones. They don't like that. The people think I'm mad and I'm not. So cosmetically, it's going to help. Let me check my team. Sorry, I was checking some text from the team. Soften lines, prevent them from getting etched in. You can do it to where you can still move your face. Everyone thinks you're going to be super frozen. I'm like, no, you can dose it based on your goals and your muscles and how strong they are, and you can still move your face if you want. I have some people that want to be frozen, so we got to talk about what you want. That's always the biggest thing. That's why I say consult. Other benefits for Botox that we will do in the office. I'll talk about different areas as well. So people will use it for TMJ symptoms like headaches, clenching, teeth clenching, grinding, jaw pain. So we'll treat temporalis muscle, this muscle here. You bite down and feel it on your side, kind of flex out, or here, you bite down, you can feel this muscle here, masseter muscle. Both of these are chewing muscles. So we have a lot of people that come in and they say, I've got really bad TMJ symptoms, clenching, headaches, teeth grinding, jaw pain. I've broken teeth. I've bitten through my mouth guards. My dentist said I'm grinding all my teeth down. I can't sleep because I'm always grinding, or my partner is mad because I'm grinding my teeth, or I had to miss work because I have such bad pain. TMJ Botox works wonders as long as it's your muscle that's causing the problems. The ones that it doesn't work on is if they're like, my go like this, my jaw is popping out of socket. I'm like, that. It's only going to work on the muscles. If it's a joint, if it's the teeth, if it's the bones, that's your surgery. That's your dental person. But we do a lot of TMJ Botox. We do Botox for migraines, Botox to relax the traps. People that feel like they're really tight up here and they feel bulky here, we will use Botox to relax here. I do Botox for the palm. I was working out this morning. Look at those calluses. For sweaty palms, sweaty feet. So hyperhidrosis, so excessive sweating. I will do Botox into the calves for people that are trying to slim their calves or they feel like they're really bulky. Other areas on the face that we do Botox besides the frown lines, the forehead lines, around the eyes, to soften the crow's feet or to give a little lift. We'll do Botox in the nose for, you can see this a little bit like these, they call them bunny lines. Sometimes if you only Botox here, here, and here, when you go to make an expression, this muscle will keep moving. So we'll Botox there. I can do Botox along the nostril to prevent flaring. Do Botox right here on the side of the nose for people that when they smile, they feel like their lip raises up and they should have a gummy smile. So this will prevent the lip from raising and it'll cover some of the gums. So they like the way they smile. They feel like it looks better. Some people above the upper lip, called lip flip. If they smile and their lip curls in, Botox there prevents it from curling in. Botox above the upper lip also, if they have what they call smoker lines or like the vertical lip lines, it'll relax the muscle from making that motion so forcefully, and so the lines soften. Botox at the side of the mouth when we go, sad face. I look like I'm always mad and sad. I always turn down my corners of my mouth. This will help prevent you from turning down so hard. Botox into the chin. If your chin dimples or has a lot of looks like little pebbly bumps, Botox will relax that muscle from flexing up and not have the dimpling. My team is texting from flexing up and not have the dimpling. My team is texting me. In the neck bands, into our platysmal muscles for softening these muscles, and so these bands don't show. It kind of tightens the jawline as well. Let me think if I missed any spots. I've done Botox, like just kind of full face for people for excessive sweating, or they just kind of want a pretty glow to their skin. But those are, and then I said migraines already. Those are a lot of the spots I do Botox. I hope I hit all of them up. And if not, I can try to think of more and go back. Oh, relaxing the trap. Yes. People like that for here. When they feel really bulky here, it relaxes. And they feel like, oh man, I can recruit the muscles I need to recruit when I'm exercising and not just put all my stress here. I don't feel so tight here. I have a lot of people, they like this. Dr. Danny said, I need help with my under eyes for sunken. I'm not a fit for filler under the eyes. Okay, so if you're not a candidate for filler under the eyes, let me mention who's not a candidate for under eye filler. If you get puffy under your eyes, if you cry a lot, if you have bad allergies, anyone that retains a lot of water around their eyes, don't do filler. Because filler that we put under the eyes, hyaluronic acid, binds water. So if somebody tells me I'm always puffy, I'm like, if I put this filler in here, your filler is going to swell up and down. It's going to look puffy. Like it's going to look worse. I'm sure you guys have seen it and it just looks bad. So make sure you're a candidate for any treatment that you're doing, but especially under eyes. The skin is thin. This area is, you don't want to overfill it. You don't want to be the wrong candidate for it, or it looks bad. So if you're not a candidate for filler, you can do the Easy Gel All Natural PRF. So we draw blood from your arm. We put in the tubes, we spin it in the centrifuge, a little spinner, and it separates out platelet-rich fibrin, platelet-rich plasma. We take out that has your growth factors, your stem cells. We end up heating this, then we cool it, and we make a gel out of it. So wherever we place that, which most commonly, a lot of people come for this under eyes and smile lines, but you can do it your full face. I've done my full face multiple times. It will make new collagen over time, and it's not going to get puffy weird the way filler will. So this is, think of again as like a new collagen. Think of it as a fertilizer. It gets better over time. Limitations with this, it depends on the health of the patient. Younger, healthier patients, better outcomes. Mid-60s, you're smoking, you got a bunch of medical conditions. I'm like, I don't know how great your body's going to be able to make new collagen. So that's a limitation there. With filler, you're not a candidate for filler, but I'm just going to talk about it. With filler, I have a little bit more control over how much lift I'm going to get in this area, because I can choose which product and how much I'm doing in each person. Every person, our skin is thinner here, but some people have thicker. My skin is going to be thicker than, a woman that's fair and 65 years old. I have to use a different product on her. So I can pick and choose a little bit over which product is going to give me the outcome. Whereas with the all natural filler, I'm waiting on your body to make new collagen. So again, most of our patients, 20s to 40s, even 50s, really like it. I really like it. As long as this is not overnight. This gets better over time. Lead a healthy lifestyle. It will help your outcomes. We do that. I brought that on because the patients were asking me. They probably asked me for 2 or 3 years before I was like, I don't know, guys. I don't want to bring. And because I'm so used to filler and being able to get the instant results. And then I don't think I would have done it. I mean, I would have done it, but not like to the degree that I have if it wasn't for me having this third baby that I've been breastfeeding for 2 years. I have been put in the position where that's all I can do, and I really like it. People are like, "Are you going to go back to filler when you stop breastfeeding?" I'm like, nothing is like killing me where I feel like the all natural filler hasn't been able to do. So like I've done my temples, my eyes, my smile line, like I've done all the spots that I've done, like with filler over the years. It's been 3 years since I've done filler, and I've breastfeeding the kid, so he sucks the fat out of me. But if I see something bothering me, I'll put the all natural filler, and it just doesn't bother me. Like in a few months, I'm like, oh, it doesn't look so sunken. Like I'm not feeling self-conscious about that area. I like it, and we don't have issues with it from the patients. I love filler. I'm not going to talk bad about filler. I love it. But like, it's a little more temperamental, and I got to make sure I'm doing the right product, the right patient. The patient understand, filler takes longer to settle. They're, I feel a bump. They're going to say that to me at 3 weeks. I know you feel a bump. It takes 6 to 8 weeks. But like the all natural filler is not temperamental. It just looks a little overfilled for 3 to 5 days. I'm like, you're going to look swollen. You're going to look like you've had bad filler for 3 to 5 days. It is just the swelling. It will chill. I've never had anybody with issue after it beyond that. Like it always looks natural. It looks nice. Yeah. Okay. That's what I would say. Okay. And someone said, does Barbie Botox make it hard to lift? Okay. I treat some people that are like athletic trainers, like instructors, and I was concerned about that for the Botox into the traps. And they told the ones that are coming for it they feel like they're tight. They told me no. They said it's actually better because then they're not using these muscles, overusing these muscles. Like I'm able to use my stomach muscles or my back muscles that I should be recruiting, but I haven't been recruiting because I'm always putting it through my traps. But having said that, I will tell people for the traps, like I typically don't go super aggressive your first time. I go like a medium dose where you can see it, and then give me feedback in 2 weeks, and we can do more if you want. So these can take like 100 units per side. I'm usually doing like 30 to 40 per side. Let me know in a couple of weeks if we should do more. Easy to add if you want. 23 messages. Let me keep going. Can I get the filler if I'm on blood pressure medications? You should be able to. However, I just say, I try to make sure people like medically, like make sure your medical conditions are like under control. If you're like, oh, I just take this blood pressure medication and like my blood pressure is fine, but I'm not spiking up and down. If you're telling me your blood pressure is spiking up and down, I'm like, hey, just to be safe and smart, like make sure that is managed before we're doing, I love Botox and filler, before we're doing that stuff. So, but yes, we treat patients they're like, oh yeah, I take this and it's controlled. And they have no issues. PRF for hair growth as well. Okay, I have not been talking about hair. I need to do this. So yes, we have a whole hair health program in our office and this really stemmed from a couple of the team members, one being Dr. Niani, our nurse practitioner, dermatology nurse practitioner, another being Vanessa. She is like a licensed cosmetologist, like trained first in hair. And so some of these patients and then from our patients asking us, what can I do after I lost hair from pregnancy or from weight loss and all of that? So in our office, we can do the PRF injections that somebody had mentioned. It's the same thing where we draw your blood. We separate out your platelet-rich fibrin, platelet-rich plasma. We inject that wherever you're noticing hair loss. So a lot of times for people, it's here. Depends. I have boys that come back here. And we have some really good videos in before and afters showing the results of this. Typically around 3 months, they start to see it and they start to get excited. 6 months, it's like, whoa, they really can tell a noticeable difference. We're combining that in the office the same day with a scalp facial. So this is detoxing, like declogging the hair follicles, build it from sweat, product, oils. Like we're trying to make sure that these follicles can breathe. So people will come in like, I just washed my hair. And you can still see after we do the scalp facial, all the debris, all the junk from their scalp that we're able to debride. And they're like, it just feels healthier. It just feels lighter on my scalp. It feels less inflamed. Anybody with dry, itchy, flaky scalp, they really like it. They're like, I just feel hydrated. So we're doing those the same day with red light therapy, which also helps with hair growth. We encourage Nutrafol supplements and scalp massage. So patients like that, they come in on a monthly basis. We have men and women that do it. We also are going to talk about what are the reasons for why you're having this hair loss or thinning. A lot of times, we see a lot of women of color, and they'll be like, "Hey, I wear these tight braids, or I wear these tight weaves," and they're like, I've been doing this for years." And I have some people that have I was just looking at pictures on my phone earlier, and this one woman, she's just like, it's been for years. And like, they start really losing hair and it's like really pulled back. So like, okay, some of that we might be doing other prescription medications, topical or oral minoxidil. And we'll talk about like limitations of what we can do or cannot do, or maybe you should, are you ever going to consider a hair transplant if it's like really bad? But the bigger things, if we can minimize those triggers. So if we know it's from tight hairstyles, if we know one of the boys that has shared his videos online, he's like, I bleach my hair all the time. And he's like, my hair has been getting thin. And my dad's hair naturally got thinner around this age, but he's like, this is not helping that I'm bleaching my hair. So like we pause the bleaching so we can really work on his scalp health, his hair health, and you can see huge growth. He's like, I used to have to get my haircuts, I think every 3 weeks. And he started telling me 2 weeks. Now he's saying every week. He's like, this is getting too expensive because my hair is just growing in. And so, but he's really excited. He's like, my barber can see it. Like we can visibly see it in all the pictures and videos. So that is really nice. And come in the office and we have that. So we have 3 membership programs. We have the skin one, which is our most popular. Come in on a monthly basis. We can help you pick and choose from which skin treatment you're going to do. We have Hydrafacial, bio-repeal chemical peel, aerolase laser, and skin pin microneedling. Everything we do in our office, safe for all skin types, all skin tones. Depending on what your skin goals and concerns are and how you present, that will help direct us in which treatment we're going to do. You can combine these treatments on the same day. A lot of people will do 2 or 3 treatments on the same day, depending on what their goals are and what's going on, how aggressive they want to be with their treatment, if they have downtime or not. So come in on a monthly basis, you do that. And you can also do the all natural filler. That's a part of the membership, and that's at a reduced rate. I think it's like $9.50 as opposed to, we usually do a 2-pack for $25.50 for the all natural filler. So people come in, they're doing their skin treatments, they're doing their collagen stimulation all in the same day. We have some people that are on all 3. And then they're doing a hair health program. So they come in, we do the scalp facial, we've drawn their blood for their easy gel PR, for their face, and we've drawn blood for their scalp. And so they're going to get their PRF injections for hair growth, their scalp massage, the red light therapy at home. They're doing the Nutrafol. We may or may not be doing prescription medications as well for hair growth. And then we have a weight loss and wellness program. And so we do Zepbound injections, come in on a weekly basis. We can send patients home for 2 to 3 weeks max with injections. But really, I know patients are like, I can get it online. I'm like, you can totally get it online. People that are in the program, they want to come in. I'm like, do you want me to send you home so you don't have to come in next week? They're like, no. I want to come in. They like the encouragement. They like the accountability. We're checking in. We're managing. If you're like, I'm nauseous, we're like, okay, we've got you. We've got prescription medications to help that. But we're also helping to like dial in your dose based on what's going on. So some people will go more aggressive and we'll jump them up faster depending on how they're tolerating it, what their goals are. Other people are like, hey, I just want to be at this really low micro dose. I feel better. I feel less inflamed. It just helps me with curbing my appetite, but I'm not like losing weight. I'm not trying to lose weight. So all of these things are going to be personalized, customized to you, your goals. So this is why I say we talk a lot, and I'm talking still a lot. But in person, we're asking a lot of questions to know about you, your lifestyle, your goals, what's going on, all the things we need to know. And the whole team, it kind of knows because you might be seeing multiple of us, or might be like, hey, I need you to see Niani, or hey, I want you to see Claire or Vanessa. She's going to do this hair thing. Like, we know she's stronger over there. Like, we're all very talented. But sometimes I'm like, I want you to talk to her for this or whatever. But we're all in communication, and I tell the patients, I'm like, it's not just when you're in office that you're talking to us. Like, call us, text us. It doesn't just have to be that you have an appointment. If you think of something and you're like, I saw this thing on TikTok, should I do this? Call or text, and like, we'll tell you yay or nay, or like, actually, we're going to have to see it in person, or send us a video. So our biggest thing is we never want people to feel unheard, unsafe, unseen. Like, it is very important to me. I was like, what we stand on is like, making sure people feel safe, seen, heard, beautiful, natural results. You're an active part of your treatment plan. So we're asking you questions, we're asking what's going on. And yeah, it's not random what we're prescribing for you, basically, what we're making up in your treatment plan. It's all based on you. Thank you for Sandy Kane. Thank you for sending me some hearts. I appreciate you. Okay. Let me see. Natural filler. Okay, what lip filler do you like best? I want a long-lasting filler with a natural look. I like using contour in the lips. So it's a part of the Restylane line. This is indicated, FDA approved, indicated for like the cheeks. However, I use all these products and we don't always use them how their FDA like did the studies on them. I like it in the lips and I use it majority of the time. I feel like it gives nice structure. It's easy to build on if you want to go fuller. It doesn't get puffy above. It doesn't leave lumps and bumps. The texture of the lip is nice. You still have a little bit of lip line, which I think looks natural. Some of the products, I think they blow out the lips and they look so juicy, so full that they have no lip lines. I'm like, okay, it looks like you got lip filler. So it just depends on what you want. Most of our patients that are coming, they want to look like themselves. They want to look fresh. They don't need it to be something where everyone can clock. They're always like, no one can clock what I did. And they tell me, no one can clock that I did anything. I'm like, great. So I like that product, but it depends on the patient, their goals, what's going on. But we use that a lot in the office. Other products I'll use, Velour, Define, Kiss. Like you can use like multiple different things, but that one I in general don't have issues with. How long does nose filler last? Nose filler, I do it over 2 sessions, camouflage a bump, lift the tip of the nose, create a highlight down the center so it looks a little thinner, can minimize asymmetries on the nose. I say it lasts 1.5 to 2 years. A lot of people get longer than that. So at the 2-year mark, they'll check in. If it looks great and I'm like, we don't need to do anything, we just wait. So it holds on a nice amount of time. Our patients really like that. Someone said, Steph said, I'm getting cheek fillers on Thursday. So excited. I'm excited for you. Some tips for you if you're getting any upcoming injectables. Avoid blood thinners, avoid alcohol, take arnica, eat pineapple leading up to your appointment. Eat something the day of your appointment. Don't go in there on an empty stomach. Make sure, because I don't want you to be like having a low sugar and feeling lightheaded. Ask your provider questions. Talk to them about your goals. Just go be in the conversation with them. That's the biggest one. But I am excited for you. Don't rush it. I tell patients when they're doing filler, I'm like, give it, the first few days is going to look a little extra. If you like it when it looks extra, you're probably going to want to add more, but wait 6 to 8 weeks before you add anything. The first 2 to 3 weeks, your swelling's coming down. After that point, you have a pretty good idea of what the results are around 2 to 3 weeks. You still might feel little bumps. You might feel the filler, not usually in the cheeks, but certain other areas, like around the mouth, you might feel it. It'll settle. It takes 6 to 8 weeks. At 6 to 8 weeks, check in with your provider. Great. You can always do more at that point if you want. I see people on here and they'll say, oh, my provider went and did it in 2 weeks and 3 weeks. I'm like, dude, the filler hasn't even settled and you're just adding more to it. Like, this is going to freaking take forever to settle because now you keep adding product to the same area. This is not good. You're going to have lumps and bumps. Like, stop. Go slow. Don't rush on your face. Okay, sorry. You were just excited. I'm just trying to give you tips. I think you're going to love it. It's going to be great. What about the crown? Yes, for hair loss here, there's I do so many videos. They're probably so far down, but I'll post some so you can see, or you can go on, I think on my other page, you can have it, but I have videos of guys showing like their hair in, do I have any girls on there? More their parts, but not like the full, like there, for hair regrowth. So yes, it works and works well. Hi, Jocelyn. Love you so much. And miss you, and you're so funny. Any recommendations for nursing school students wanting to get into medical aesthetics? Yes, I would say if you can, shadow in offices or be a medical assistant or a phlebotomist or something, intern, like anything that you can do, getting a job in a medical space, in a medical aesthetic space will help you when you get out of it. I have a lot of people that ask me like all the time, and I just can't get to all of them. It is the ones that like kind of keep coming at me that I'm like, dang, this person is persistent. Okay, I'll give you a day. I'm like, come on, come shadow for a day. if I feel like they're like a good vibe with our patients, with our team, and like, okay, then I'm like, you can come back another day and shadow. And then if I keep like, I'm like, you can come another day. Till eventually I'm like, just come on, be on the team. So that happened with one of our recent, she's an esthetician and a nursing student. Her name is Ashlyn. Beautiful. She messaged me. She kept messaging me. She kept contacting us. I was like, no, I don't have any time, because people also will message, and sometimes I used to just bring any and everyone in, and sometimes they're like disrespectful to the patients, or they're late. They're like, oh, just disruptive to the clinic flow. And I always have to be patient first. Like, that is the thing with our clinic. They know, like, the patients come first. I had one girl, her mom begged for her to come and shadow me. She was a high school student. I was like, okay, this girl was like eating Cheetos, talking during the thing. I was like, I can't have this person in here. So I'm pretty selective. Now it's like only the ones that are super about it. If they keep asking, I'm like, okay, let me give them a hand. Like, okay, come on in. And then if they're cool at the office, I'm like, come on back. And then they become a part of the team. That is kind of how it's been for like everyone on the team. I hire almost just off personality. It was not my intent to be having this big team. That was called Janelle Beauty Aesthetics. I just wanted to be in there, see my patients, like my patients that have been in here, hey, Manhattan Dermatology, that I've been with forever. And I just wanted to see them and be out and go home and feed my baby and keep moving. However, I can't see every patient. And then I started meeting nurses that are really cool and that I like being around. And I'm like, oh, like, you have the same aesthetic outcome and goals that I do, and the same, like, how you treat your patient as I do. And like, yeah, we can't be together. And so now I love, love, love every person on our team. They get along, they don't fight, they help each other out. Everybody has each other's backs. Our patients love them. I mean, I hear it from the patients because I see them all. I know them all. My patients are like, hey girl, what's up, Janelle? Like, I know these people like on a personal level, and they give me feedback, and they love the girls. And that makes me feel really great. And the patients are taken care of. I can see the reviews. I can see their before and afters. We do a lot of training. I do like one-on-ones with all of them. I'm like, what do you want to work on? What do you think we can work on? Like, where can we tweak this skill a little bit? Or we'll do group trainings, group meetings, with going through patients, just all the things. But it's a great team. And I put a lot of heart and thought behind everything I do, and prayer, and like, God, please direct me in every single thing I do, behind everything I do. And I feel the same from the team. Okay, lots of good questions in the chat, Ugoshi. Okay, let me go get these questions. Quit talking. Have I ever done cheek filler? Yes, I have done cheek filler. Look at that. And look at this. But this is like 3 years ago. This is 10 years ago when I hadn't done anything, and the baby sucked all the fat out. My first kid sucked all the fat out of my mid face. I like it. Make sure you see a provider that treats people that look like you. Look at before and after photos. Don't rush it. I think that's a big thing, because I will say, I treat a lot of women of color, Black women in here, and like, we can't use the same product. We just can't, as every person else. Like, there's the products are different, and sometimes I'm somebody with a fuller, thicker skin, more fat in their face. I need a fuller, thicker product. I need to use something dense. Whereas in somebody that might not have as much fat in their face, I can use a softer product, and it gives a pretty contour. If we use a soft product in my face, which I had people do years ago, I was like, I don't see a change. I don't see a change. They kept adding more, 4 syringes. I was like, I still don't see a change. Eventually, I just looked pudgy. You don't want that. So go to somebody that treats people that look like you. Look at their before and afters. Read the reviews. Don't rush it. Even for all my patients that I love this and I do this day in and day out. They know I'm like, do some, let it chill, reassess. We can do more later. We don't want it overdone. So that's the biggest thing. So that was for Rachel. How long does PRF Easy Gel last? The gel, like, immediate lift that you'll see, I feel like you can see for about 6 weeks. That, like, it's kind of like lifted. Then you're doing your second one. So you're adding to that. And then new collagen is happening in that time, like 6 to 8 weeks, up to 6 months. So that's where your body's going to be kicking in. But that initial little lift part, I think you can see around that much time. New collagen, how long does that last? That lasts for years. But again, the healthier you are, the better your body can make new collagen. So that is important. Okay, how do you fix the under eye bulging when smiling? I have one eye that does this when I smile. Let's see. Yeah. Some people, if it's like a little fat pad, I don't know, without seeing you, I kind of need it. Is it this? It is a little fat pad. We all have these fat pads underneath our eyes. I'm trying to make it. So we all have them. Some people have bigger ones that stick out more. If it is like a big bulge, I tell patients we can't get rid of the fat pad with non-surgically. Surgically, they can go in there, they can take it out, or they can tighten it. Non-surgically, look on my page. I've done a lot of under eyes, period, and ones with big bulging eye bags too, and I can camouflage the bag. So I'm like, surgically, you can go in there, tighten it. It will likely keep protruding forward as you get older and descending, like sinking and looking bigger. But non-surgically, I can hide it pretty good, usually on most patients, if you're a candidate for it. If you don't get puffy, if you don't cry a lot, if you don't have bad allergies, you don't retain a lot of water around your eyes. Where would I place filler for sagging skin, nasolabial folds, and jowling? So if this is saggy, this is deep. We're going to do a little through the mid-face, possibly lateral cheek and temples. I have to look at the face, but these are areas I'm thinking about. Here by the side of the nose, we lose bone here. Lightly through the lines, not trying to obliterate the line, make the line be all the way gone. No. And then if it's this jowls, I got to look at it. Might do a little into the chin to bring forward the chin, and then camouflage this area in front and behind the jowls. Thank you, Manhattan Dermatology. I hope you're doing great. And so I have good videos on that, and before and after photos and videos. Sujia is one. She's a big creator on here, and we've been working together for a few years, and you can, maybe since 21, and you can see her before and afters, and she had jowling and smile lines looking deeper, and she looks fresh. She looks good. She's made a bunch of videos about it. I show her before and afters, but I'm pretty sure on my page on there, you can click through patient before and afters and see. Okay, let me see if I'm missing some. Okay, gotten Botox for years, starting to get a dent shadow between my 11s. Jocelyn, filler, how to fix. Okay, so if you've gotten Botox and you're still seeing little etch lines, that is where we can consider a thin filler, depending on how deep the line is. Thin filler and or the collagen stimulator, the Easy Gel, the natural one. Filler in this area, you just want to be mindful. We don't want to do too much, multiple reasons. One, so safety, which I haven't even talked about. Let's talk about safety. Safety with filler, we want to make sure we're not blocking off blood flow. We've got blood vessels, our whole face, our whole body. We never want to put too much filler in any part of our face so that we're blocking blood flow from moving. So when we're injecting, what I'm looking for and what my team is looking for, you should not have any extreme pain. You shouldn't have any vision issues. Your skin color should be normal, not paler than normal. Any of those signs could mean that somehow we're blocking blood flow from that area. The blood vessels that run through here also run behind your eye. So you don't want to put a lot of filler there because you don't want to block off blood flow to your eye. That could cause blindness. I am saying that. I don't want you guys to run like, you're going to get filler if you get blind. You're not blind. Like, I know people are going to be like that. It's not like that. You want to be mindful about who you're seeing. You need to have a thoughtful person, not just somebody just randomly poking in your face. This is a super rare risk. It can happen. So that's why you need somebody that knows what to look for. And then if something like that is happening, how to intervene. So there is something called hyaluronidase or Hyaluronic to dissolve filler. So as long as I've been practicing, I've never had to dissolve anybody for any emergency ever. And so not saying it can't happen. First of all, I'm praying all day. Second of all, I'm being mindful. I'm like, every single time I'm touching your face, I'm looking like, is that blood flow coming? Is the skin color normal if I touch it? Does it go back pop rosy or brown or tan or whatever? Does it look normal? That shows me blood is getting to the area. I'm asking you, how do you feel? Any pain? Any vision issues? As we're going along. Super rare. You just want to be mindful. So we just don't put a ton of filler through here. Very light. That should help, Jocelyn. Also, at home, your sunscreen, your retinoid, in the office, microneedling can help. And chemical peel. I think you're really going to like chemical peel if you can be out of the sun. Okay, I hope you're doing great. I love you. Let's see. Let me see. It's like a dent. Okay, so it could be the same sort of thing. And then maybe we Botox you a little stronger. Like maybe you go higher on your dose so that it's more frozen, but I need to see it. I'm going to look at it. Tutu, what can I do for under eye hollowness? Under eye hollowness, you can do filler or you can do the all natural filler. And so filler is going to give you an immediate lift. We use hyaluronic acid filler. There's different ones we use based on how thick your skin is, how much fullness you have in your face. You put it in, it's going to give you an immediate lift. You could bruise, you could swell, let it settle 2 to 3 weeks for that. And then 6 to 8 weeks later, you can come back in and fine tune if you need to add more. If you get puffy under your eyes, you swell a lot, retain any water, you cry, you got bad allergies, don't do filler, do the all natural PRF Easy Gel. So that one is made, draw blood from your arm, spin it in the centrifuge, take out your growth factors, your stem cells, wherever we inject it, it'll make new collagen over time. You can do, I would say do at least two sessions of those. If you're really hollow, you might do more. It will continue to improve for up to 6 months. So really just depends on if you're a candidate for filler, if you want immediate results, or if you want the natural like collagen simulation way. Okay, 34, no allergies, natural slim face, don't get puffy, don't cry, then you can go filler if you want to see it immediately. I have a lot of before and afters of under eye filler on my page. Okay, let me see. Oh, hey, Kenneth, my friend. Okay, I would take your before results. Okay, thank you, Yoshi. I'm glad you like the before results. I felt really sunken and tired and haggard after losing a lot of weight in my face from feeding a baby. So, and I just look more sunken there. But everybody has their own thing. So I'm like, you totally don't have to do this. This is for people if they feel like they're seeing changes on their face that make them not feel their best selves or as confident. That is where we can, intervene with some of these treatments. I tell patients all the time, no, none of us need it. You don't need to do any of it, period. However, people come in and they say, I just want to look fresh or I feel better. I hear stories every day from my patients that are like, I felt more confident because we did X, Y, and Z. I was able to ask for a raise, or I was able to ask this girl out, or I was whatever. I felt confident to leave my man. I don't know, all sort of different things, just how it makes them feel. The biggest thing is it's for the person, like, and for them just be able to present as their best self. Okay, let me see if I am missing any. Do I inject PDGF under the eyes to improve hollowness? So Tracy, right now I am not doing that. And it is new to the aesthetic space. I think it's been around for a long time. My husband does oral surgery and he said they use it in dentistry or surgery. I don't know. And he said, oh yeah, he's like, that's really safe and it's great. In aesthetics, it's newer. And right now it's not FDA approved for injecting. So I always have to do what is legal. That's the first thing, because I can't mess up my license or my team's license. And I got to think about the safety of our patients. And so that's the biggest one. So why I haven't done it yet. I also tend to let things like any new things, I let all the hype die down. And then I start asking people, what are the results? I ask colleagues, what's the worst thing that you've seen? Tell me the worst. I start trying to ask patients, oh, have you heard about this? Has your patient, did you go somewhere and do that? I'm trying to hear, is anyone doing it? And what has happened? What stories have they heard? If everything is good, then I'm like, okay, then I start testing it on myself. I start testing it on family, on tried and true patients that I know for all my 13 years of practice that I know will give me honest feedback before I start talking about it on here. Because if I say something on here, I have to highly believe it. I don't want to be on here trying to mislead anybody. That's never, ever, ever my intent. So right now, for me and for my practice, my patients, I'm like, go slow. Like it's too new. Some of the things it's too mixed from what I've heard from colleagues and just seeing online. So some people are like, oh my gosh, it's great. I love it. Other things I have seen are like, this looks overfilled and this is lasting for months and it looks pudgy. And so I'm like, let all of that die down before you decide to do it on your face. That's what I would say. Okay. Let me see if I can find any others that I missed. And, Dr. Jenny, if you're in Cali, and she said, somebody was talking about wrestling. Oh, suggestions for laugh lines. So smile here. You can do, if you're afraid of filler. So if you're afraid of filler migrating, don't do a lot. That's the biggest thing. Don't overdo it. And I think they're trying to talk about products. Yeah, use the right product, not too much. Don't rush it. That's the biggest thing. If you don't want to do filler at all, you can do the Easy Gel all natural filler, or you can do something like a collagen stimulator, Sculptra, or dilute Radius. So that will help make new collagen over time. To book a consult, you can do it through the top of my page. There's a link there, or you can do it if you text the number on there. We can help you set up there. Yeah, and you can come see me, see the team. The whole team is excellent, and I love these girls, and trust me, they do my face. So what product? Rachel was saying what product? Let me see if I knew what product she was talking about. Have I done cheek filler? Yes. And she was saying, what product have I done? So I've done multiple products in my face. I like the best Radius. Radius is a calcium-based filler, mimics bone. It has the most structure, and it gives like the most lift out of any of the products. I've used hyaluronic acid fillers in my face, and I'm, naturally cheeky before I got all the fat sucked out of my face from a baby. And the hyaluronic acid fillers in myself made me look a little pudgy, and I did not like that. And so I do use a lot of Radius in our practice. Again, I don't like talking too much about products on here, because then people are going to come in and like, I just want Radius because you said you liked it. But I'm like, I have to make sure it's the right product for you and what's going on. So every face is different. I got to feel on your skin. Like, I will say I use it on a lot of women of color, a lot of people fuller, thicker skin, but some people I'm like, oh, you don't need Radius, or like, honestly, a little bit of a softer product, because you just have a little bit of flattening. You don't need a ton of structure. So there's different products. The big thing is like making sure your provider understands the properties of the products. They can show you patients that have that product in their face, and God willing, patients that look like you, so you can kind of understand what the outcome will be. But in general, yes, I use Radius. I love it. Gives the most lift. It does swell a little extra in the beginning, and so it looks exaggerated, where, when I do it, I feel like, oh, I got Maleficent cheeks, and my husband's like, you have a Jay Leno chin. Why did you do that? I've done my chin a bunch of times. It looks extra for like a week and a half, and then it chills, and then I like it. The softer ones, when I do them, like in my chin, my husband won't know. Remember, I haven't had anything for a while, but he wouldn't know when I did them, because they don't swell that much. But also, after a week and a half, I'm also like, do I know if I did anything? Like, it's too soft. So a big thing is just making sure it's the right product in the right patient, period. Yeah. And understanding everything that comes with it. Yeah. Okay. Let's see. Meg Scope is, I don't know, as you guys could be related. I don't know who Meg Scoop is. Okay. And then let me see. Does RF microneedling destroy fat pads? I don't know, but I've heard that from patients. Like, I don't do it in our office, in my office. I've worked with it in practices. I have heard patients that tell me they feel like they lost fat after it. So it could be good if, I remember one lady liked it because we did it under here, and she felt like it tightened and it got rid of some fat cells. I've had other people have said they feel like they made their face look more sunken and they don't like it. I think tread lightly. Any foods you should avoid, maybe before you come in for filler, or after. After, I would say avoiding salty foods, spicy foods. It might make you a little bit more swollen those first few days. Prior to foods, salty foods, if you tend to swell a lot. Eating pineapple is helpful. And yeah, I do one treatment and I lost fat in my temples, and I don't like it. RF microneedling is what you're talking about. Yeah, I'm telling you, I've heard those stories over time. And so I'm like, from people where I'm like, anything I offer in my practice, I got to stand 100% behind and like fully believe in it. And the RF microneedling, I know there's different ones. Morpheus, that one had a lot of hype in the beginning. You got to think, guys, the companies are putting a lot of dollars behind marketing it. And so it gets everybody excited. Everybody was doing the Morpheus. And then I was just like, let it die down. And I like, let me ask the patients that are doing it. And I started hearing stories like that. So I don't know, talk to your provider about it. Look at your before and after photos. If you feel like you're losing fat, I'd probably not retreat in that. I don't even know what that was. Retreat in that same area. You can consider Easy Gel. You can consider filler. You can consider something surgical like fat transfer. Okay. If you don't like filler, can you break it down? You can dissolve it. Yes, You can. It might take multiple sessions to dissolve. Which is better for crow's feet, Botox or Dysport? I like them both. I offer them both in my office as well as Xeomin. My own self, I like Dysport. I think it kicks in a little faster. It's a little stronger, but they're all great. But you can do any of them. They're really good. And just, I tell people, I'm like, try and see if you have a preference for one or the other. Is microneedling good for hyperpigmentation after acne, or does it cause more dark marks? So if your acne is controlled, yes. If you're not breaking out, then you can do your microneedling. And it will help with hyperpigmentation. It should not be causing more dark marks, but you got to make sure you're doing your post-care at home and really avoiding the sun. So yesterday when I was in Vegas, I was seeing a patient and she was coming for injectables and I was talking to her about skin. We're always going to be comprehensive and go through everything. And she said she was like I don't know what you call it, bottle girl, like a girl that goes outside and gives drinks, service girl. She's a cute girl. And then she's like, I do that and I'm outside every day. And she's like, I've been getting this laser at this other spot. And I said, okay. I was like, so what are you doing sunscreen? She's like, I don't wear sunscreen. I was like, girl, you cannot. She's like, I just did the laser twice. But I'm like, in your skin, if you're doing lasers, microneedling, chemical peels, using retinoids, using acids, your skin is going to be more sensitive to the light. If you're getting sun on that skin, because it's turning the skin cells over faster, you could make dark spots worse. And like, I'm like, you got to wear sunscreen. Like, don't do your treatments if you're not going to wear your sunscreen, because then you're honestly like wasting money. So, hey, Vanilla, thanks. So microneedling should be great for acne. You don't want to have active acne and spread active acne with microneedling. But like if your acne is controlled and you're trying to work on pigment, yes, we like microneedling. We like a chemical peel, add it on the same day. And sometimes we even add on the laser the same day. And then we say, stay out of the sun. Go home after this chills. Use your retinoid, use your sunscreen. Yeah, you have to let it chill for like a week before you start your retinol. Use your vitamin C. So we're big on like you doing your part at home with your skincare to complement what you're doing in the office. But yes, microneedling should be good. And then let me see. Hey, Vanilla, I don't even know what all these things are, but thank you for sending all these hearts. I appreciate you. God bless you. What about dark circles? Okay. And tired eyes. So if you like this, if you feel like your eyes are sunken, filler, all natural filler. If you feel like you're not sunken and it's just dark, and you're like, no, it's not sunken at all, I don't know anything to change the color of your skin. Most of the time, it's either the color of the skin or the skin, like on somebody fair, you can see through the skin and it's like their blood vessels. And we can't take away your blood vessels. So most people are like, they feel like they're sunken plus the dark. So they're like, oh, and I say, I can't change the color. But if we lift the sunken part with filler or the natural filler, it'll reflect light off the face brighter. So then they'll say, hey, you said it wasn't going to change the color, but it looks bright. I'm like, they're like, it looks like I don't have dark circles. I'm like, I know, you were catching a shadow before from it being hollow. Now that the hollow's lifted, it's brighter. And then if you still have dark, you can put concealer on. So, and then they'll tell me my concealer actually works. Whereas before I'd put concealer on and it still looked sunken and it was still creating a shadow. So hopefully that answers that. So kind. Thank you. In Vegas, our office is on the Summerlin side by the lake, like by Lake Las Vegas. And it is 8861 West Sahara Avenue. And I was there twice this week. I think I'll be there in a couple weeks, but the team is there seeing patients and I just come and kind of pop in sometimes and do patients as well and work with the team. They're wonderful. And they are in LA sometimes training and working with us as well. Hair growth for hairlines, please. Okay, yes, we can talk hair growth for hairlines. Would you ever come to New York? I know somebody on here was like, I'm going to come every day until you tell me you're coming to New York. I was trying to get my license over there, but I had to take, I don't know, some extra New York class and Texas is doing the same thing to me. And I'm like, so maybe, God willing, I will keep working on my licensure over there. Okay, somebody said hair growth. That is where we're thinking about doing our scalp detox facial. We're going to deep cleanse the scalp, make sure that the scalp and the hair follicles can grow. We're not blocking it with product, with oil, with sweat. So we're cleaning that out, hydrating the scalp so it's not dry, so you have a good, healthy environment to grow. We're drawing your blood. We're taking out your growth factors, your platelet-rich fibrin, and we're injecting that into the scalp to help hair growth. We're using red light and then scalp massage in the office to help with hair growth, and you can hopefully do that at home too to help continue. And then at home, you're using your Nutrafol with or without prescription medications like minoxidil, finasteride, topical and or oral. Okay. And we have a whole hair health membership. So people come in on a monthly basis and they get these treatments done. Okay. How long does under eye filler last? I tell patients 1.5 to 2 years. Most patients get longer out of it. And they like it a lot. So big thing is go to somebody that can do it right, because you don't want to have long lasting filler and it looks bad. Don't rush it when you're doing under eye filler. This area, you don't want to overfill. The skin is thinner. You don't want it to be puffy. You want to make sure you're a candidate for the treatment. You don't swell a lot. You retain water. You don't have bad allergies. You don't cry. Anybody with water retention through here, don't put filler or it's going to look really bad. Okay, let me see if I have missed any of these questions. I'm trying to do. How much is a syringe of Dysport with you? I'd love, oh, Francis, thanks. So Dysport is similar to Botox, to Xeomin. We have those in our office. We can use those for frown lines, forehead lines, around the eyes. It depends on where you're at. In Los Angeles, I charge $15 a unit, and how many units you need depends on how strong your muscles are, what areas we're treating, how big the areas are, how restricted or like frozen you want to be. People will spend anywhere from, I'm just making up numbers, like $600 to $1,200, $1,500. It depends on what's going on and like, again, how frozen they want to be. That's kind of average. In Las Vegas, they only sell it by the vials. And so that's just like the state rule. A half vial, so 50 units, is $650. A full vial is $1,300. So we determine how, whether picking vials or units, we're choosing that based off our assessment of your muscles and your goals and your face and all of that. So cool. Let me see if there were other ones that I missed. Okay, if you have other questions, please set up a consult or call or text your team. Number is at the top of my page in there. They can help you with setting up a consult. You can do in person or you can do virtual consults. I like to virtual consult patients before they come in or with the team, just so we can go through your questions, your goals, give you tips on what to expect, how to prep for treatments. The patients that do this, they come in, they know they might not bruise, but they're prepared to bruise. They know that they don't have a major event coming in. They've already been taking their arnica, their pineapple. Like, they kind of know the game plan. When they come in, we still continue to go over their treatment plan that we started developing virtually, and we start that treatment plan that day. And when you come in, we're likely doing multiple things. So patients are coming in, we're looking at your skin health. We're going through, what are you doing at home skincare wise? We might make recommendations for you at home to continue to complement the treatments that we're doing in the office. We're doing skin treatments. So it could be laser, microneedling, chemical peels, Hydrafacials, depending on your skin concerns and goals. Then we're going to be looking at how you're aging, what is going on, what concerns you. We're looking at, I'll talk to you about how the face is aging and where we are losing volume as we age. We'll look at your face from all the different angles. I tell people, I'm like, I don't want you just looking fresh from here. Like, the world is seeing you here and every angle. I need to see you in animation. So I'm like staring at your face. I'm like, I'm sorry, I'm not trying to stare, but I'm like looking at you talk. I'm looking at like just any little thing. Like I'm like, oh, that brow is moving a lot. And I have to ask, do you like when that brow moves a lot, or do you want to calm that brow down? Like, we're asking all these things. And they'll be like, oh, I didn't know that. Or just all the stuff we go through. Ask all the questions anytime. I hear my kids screaming. Do I treat on weekends? Pretty rare that I see patients on weekends. Sometimes I do. In the Torrance office, because that one is, I'm closer in the South Bay, or in Vegas. I'm out in Vegas. I will. My team is working Saturdays there now, so I got to make sure everything's going chill at the office and my kids downstairs screaming. But call us, text us. The team is excellent. I have worked with these girls for years. Mackenzie, who runs our phones, and Akira as well. But Mackenzie used to be a medical assistant in person with me. She was standing next to me for every patient. She knows every patient, period. She knows every answer. Like, she's on it. The team is like that as well, but we all are collaborating. We're working together and chatting with you. I will try to come back and do more questions. If you think of anything, call or text is going to be the fastest. You can also send a message to me on here, but sometimes I miss them because I'm just moving and these kids are hollering downstairs. So just like if you text, if you're like, what is this? Snap a picture to us. It's a HIPAA compliant line. Your photos aren't going anywhere. If you're like, do you think I'm a candidate for this? We might start asking you questions, or we might say, hey, we need to do a consult. But you can we can get like a little bit of info to you and start sending you information about the treatments that we advise, pricing, all the things. We have financing through Cherry. So you can just prep, before your appointment. Okay, I appreciate you being on here. I hope you have a great day. God bless you. Thank you. If you think of anything, please let me know. I'll talk.